be about 25-minute presentation, and we hope to help provide a better understanding of the Indiana Telehealth Network, how it exists today, and ways that it could be utilized by the healthcare entities throughout the state. So my organization, Indiana Fiber Network, is comprised of 20 independent phone companies, mostly rural in nature, and we were established in 2002 to help support those independent phone companies by building a backbone of fiber optic cables to connect all these phone companies. And IFN is, in essence, the operating company for these 20 independents that helps provide internet access, private fiber connectivity, and some voice switching. So we're built to be a wholesale service provider. And again, with the independents being rural in nature, our network spans throughout most of the corners of Indiana, and a lot of times in areas where maybe there wasn't a density and high bandwidth cables, whether it's fiber or coax or copper. And IFN has been lucky enough to be very involved with IRHA and the deployment of the Indiana Telehealth Network, which we'll be talking about today. And we actually host that platform and hope to go into a little more detail about where that is and what that means. And we also help connect a lot of the hospitals and healthcare facilities throughout our state. I'll turn it over to Rob, and he's going to share with you the Healthcare Connect Fund and kind of a history of the program, and then also later speak with you about different ways it can be utilized both for the Indiana Telehealth Network platform and other technology uses.
Thank you, Cory. Just like to start, I guess, with this kind of the history of the initial pilot program. The state of Indiana, kind of the telcos under ITA, working with IRHA, came up with the cost analysis for what it would take to build fiber to the 35 critical access hospitals around the state. Kind of the number we came up with was around $19 million. So in May of 2007, IRHA submitted a grant to be, for those funds. Later that year, that application was approved in November of 2007 for that $16,100,000 figure, and that's basically 85% of the construction and the monthly recurring is what was going to be reimbursed. Over the course of the next almost 2 years, there was quite a bit of work done with the language within the RFP as well as the master service agreement, SLA terms, and things like that between IRHA and the various different vendors that were going to be bidding. The first RFP was issued out for both, construction, connectivity, as well as a shared platform in June of 2009. That there were subsequently 2 additional RFPs because the initial funding to build into those critical access hospitals did not come up to the $19 million. So the actual shared platform itself went online in October of 2010. And the hospitals and clinics had kind of the option if they wanted internet access dropped off at their location, or they could pick it up at the shared platform. It was kind of up to them. And as of today, there's over 70 of those facilities utilizing the network. And again, that's whether it's tying their locations together within a geographic area or tying them to the shared platform, various different applications. So with that, I'll turn it back over to Cory.
And just very quickly, I'll read through what the mission is for the Indiana Telehealth Network. That's to improve the health and well-being of Indiana residents, especially for those in rural areas, and that's by utilizing the dedicated broadband health network to deliver telehealth applications such as telemedicine, health information exchange, distant education, different health surveillance and emergency plans, and trauma system development. So lots of different applications, and the way to get this done is through building the infrastructure so that it can support all those services and all those demands that are more and more prevalent for rural health care. And so when you look at the Indiana Telehealth Network, I think it's really built as the infrastructure for collaboration. And a lot of times when you talk about telecommunications or connectivity, you can almost view it as a highway with on and off ramps to different destinations. And in this case, there's a large effort to make that a fast highway. Fiber optic cable is definitely the fastest medium for transmitting information. So productivity really goes up when these facilities are on net, and they can begin to collaborate with different healthcare facilities that are on this shared platform. So later on, we'll kind of talk about how it's really easy to connect to another destination that's on this shared platform. This also is an access ramp to some of the best data center facilities our state has to offer. So again, further down the line, we'll talk about different applications, but when you're on the Indiana Telehealth Network, you're on net with different data centers. It's a common platform where different healthcare applications can be consumed, take advantage of some of the economies of scale, and also the centrality of where all these networks combine, and different application service providers can meet you there to provide the healthcare services that you need. So the Indiana Telehealth Network is definitely not just an idea anymore. As Rob went through the timeline, there was a need that was clearly defined, and funding was made available, and infrastructure is in place. So just build out of to the 70 healthcare facilities has greatly expanded networks throughout the state that makes fiber cables a lot more prevalent, and probably connectivity near each and every one of your facilities that's on the call today. So the telehealth network is available for use, and hopefully you're in a position to be able to take advantage of it. So to get a little more detailed about how you connect, what's that look like? So the image you see here is what we call the Carrier Hotel, which is called Henry Street here in Indianapolis. And all the buildings you see on the right are data center facilities. Within these data center facilities, co-located are virtually any large telecommunications carrier you could think of. All the large internet service providers, cloud service providers, they have all made the decision to co-locate in this common area because that's where these highways collide. And the Indiana Telehealth Network is on net with space that IFN provides in the middle building there, which is 701 West Henry Street. To your left is an actual image of a couple of the cabinets that help host the Indiana Telehealth Network. So there is facilities with space, power, connectivity, where all these networks combine. So it's a nice image to show when you're on the telehealth network, you're on net or near net to most of the major data centers and carrier hotels that supply service throughout the state. And again, for healthcare, I think that just means that you've got the highway, you've got the high-speed connectivity to either collaborate with other healthcare facilities or have access to the applications that you need with the speed that you need. So just to kind of give you an idea of what that looks like, say this is your facility to the left, and now you're on the internet, maybe a radiologist, you're on net with data centers, and you're on net with other hospitals. So just in a real fundamental way, this is an image of what the telehealth network looks like. It's your facility connected privately with high-speed bandwidth to the internet, other healthcare service providers, data centers, and cloud service providers. So when you think about putting the network to use, You can look at just a few examples of services that are available when you're utilizing the Indiana Telehealth Network, and one is just simply dedicated internet access. So the internet access that is available is a very robust, stout internet with lots of redundancy built into it. So it's going to be a high availability type connection. With the demands that video conferencing has on bandwidth, again, the telehealth network is going to help support the bandwidth requirements to have a user experience that makes video conferencing possible. EHR, there's lots of ways to have service providers meet you at these data centers where the Indiana Telehealth Network takes you to connect. Definitely a way of practice telemedicine in that you can very simply privately connect from one facility to the next. And when you're on the network, you could, if you understand what a cross connect is, it's virtually a cable that connects from one port, from one entity to another port to the next entity, so that you can privately communicate with whatever destination you'd like to reach on the telehealth network. And then finally, disaster recovery, whether that's in a cloud type environment or a facilities-based environment, you have private connectivity to data center facilities and cloud providers that can assist you in implementing your disaster recovery plans. And the bandwidth there is fast enough where it's going to be an efficient way to implement those disaster recovery plans. Just kind of an overview of what these data center facilities are like is that they're carrier grade. So in our example, IFNs, we house a lot of our core equipment that helps power some of the state's largest hospital networks, the 70-plus healthcare networks that are on there, along with a whole host of other enterprise services. All our core routing equipment is placed in these same facilities that you would have access to. So it's something that has to be on 24/7, 365. And there's lots of space available within where Indiana Telehealth Network decided to co-locate. So when it comes to expansion or co-locating your equipment within the data center, that's very available at this point. And as mentioned earlier, most of the carriers that you might like to meet are going to be at these data center facilities. So if you have places you need to connect, you can get with the best carrier that provides that last mile connection to the facility you'd like to reach, usually at this carrier hotel data center facility that you're on net with. So again, this is kind of an image of how you can connect with different applications. So imagine your facilities on the left, and then there's a whole host of other services that you could connect with on the telehealth network that are already on net.
And this is Rob once again. We're going to touch a little bit on the permanent program, which is kind of coming out of the pilot program. The lessons learned there, they created a permanent Healthcare Connect Fund, and that's funded, Allie, correct me if I'm wrong, but I think it's $500 million nationally, kind of on a first-come, first basis. And as opposed to the 85%, which was the pilot program, the permanent program pays 65%. So basically, the funding would pay 65% of the construction of the facilities into your location, and then it would, and there's kind of two slides on this, so it'll be a little bit of duplication between the two, but 65% of the construction to go from existing facilities into your location, and then it also pays 65% of the monthly recurring costs for the circuits that you would purchase, whether that's to go to, separate campus locations or, the web or the data center and things like that. So,
and just to touch on the construction piece of it, so that's actually putting the fiber into the ground, building it to your facility, and terminating it into the telephone closet or data room that houses the equipment that lights you up to the telehealth network.
And then, Allie, if you could elaborate a little bit, maybe after I get done with this slide, on anything you want to add. But once again, 65% of the construction is funded, and I believe it's about everything except satellite, so pretty much any terrestrial connectivity. And in comparison to the pilot program, which is somewhat limited in what you could use it for, they've kind of opened that up to say as long as the location is handling electronic medical records, it's pretty much fair game. So that would include like call centers, data centers, and things like that. And once again, 65% of the monthly recurring is funded in the program. The 35% has to be provided by the end user to the service provider, and that can be obtained. What's the strict ruling on that, Allie? You can't use these same type funds for the 35%?
Right. They can come from anywhere except for the pilot program or other FCC grants.
Right. So ways that you can get that, and then we were quite successful in the first couple of rounds. I mean, obviously, internal funding would be a method within your budgets. The local economic development folks, either the local ones or the county, have kicked in substantially to get fiber built into their counties. Local businesses, obviously, are broadband users as well, so they quite often can help subsidize that 35%. And then the one caveat at the bottom, due to the federal contracts and collusion clauses and different things like that, the service providers, regardless, not just IFM, but any service provider, cannot contribute to that 35%, just as a point of clarification.
And so, to what Rob just talked about, a couple helpful links or things that have already been done. I just want to link to the IRHA website where it speaks on Indiana Telehealth Network and has Allie's contact information, and also some press releases where, in conjunction with rolling out the telehealth network and local economic development, local businesses, that 35% was there was a lot of help in getting that funded, and a lot of joint effort as communities to pull that network through, so that those costs were distributed or shared amongst as many entities as possible that had that bandwidth need. And then finally is our website, indianafiber.net. You go to our blog. We've got lots of success stories around the Indiana Telehealth Network on our blog that you can search. Well, I really appreciate everyone's time. So on behalf of Rob, Ramsey, and myself, thank you for joining the conference. Feel free to reach out to Rob or myself at any time too. We'd love to help answer any questions you might have around Indiana Telehealth Network or anything communications related.